I am Iqbal Shahriar from Bangladesh. I am a retired major. I was suffering from gastrological discomfort for last 6 months. I consulted number of doctors. Initially, they said I have bilirubin high. Later, a hepatologist, he said, okay, you go for MRCP. So I did the MRCP. After doing MRCP, he said there is a peri-ampullary tumor. Then I consulted the outside people like in Bangkok and Chennai. So from Chennai, Apollo Hospital International Desk, I got very good response. I sent the reports and they told me that your tumor need to be removed and there might be cancer in the tumor also.
Whipple's procedure is an operation that is performed in patients who develop cancers in the region of the head of the pancreas. These cancers could be either cancers of the terminal part of the bile duct or the duodenum or the ampulla of Vater or cancers of the pancreas itself. Patients who develop cancers in this part of the body can present with a wide variety of symptoms such as abdominal pain, back pain, loss of weight, loss of appetite, jaundice, and sometimes fever as well. All these patients require cross-sectional imaging in order to determine the exact size and location of the cancer and also to determine whether there's any metastasis or not. If these patients are deemed operable, they undergo a Whipple's procedure.
Dr. JKA Jameel is the gastrological surgeon. He became the main hub of the operation team and they decided to do the operation on 24th of July. As per the schedule, the operation took place and it was successful operation. My portion of tumor was sent for biopsy and the report came that the cancer is completely removed.
This is a complex operation that involves removal of the head of the pancreas, the entire duodenum along with part of the stomach, the terminal part of the bile duct, gallbladder, and the initial part of the jejunum. After resection of all these vital structures, there are a number of cut ends and they have to be stitched back together in order to restore gastrointestinal continuity. So it is a complex procedure. In fact, it's one of the most complex procedures that one can undergo inside the abdominal cavity. There is a risk of complications with these kind of major operations. There's about a 15 to 20% risk of major morbidity and approximately a 1% risk of mortality with this operation, even in established centers around the world. We here at Apollo have the necessary infrastructure and the expertise to deal with complications that might arise with these kind of major surgeries. Thankfully, in Mr. Iqbal Shahriar's case, the operation went on smoothly and he had an uneventful post-operative period.
About the service of the Apollo Hospital, the doctors, nurses, and the other staffs, they have done their best part. Doctors, they have just worked together. See, everybody has done his or her part. Nurses, duty nurses, the ICU nurses, and the ward nurses, they have done their part correctly. Even the ward boys, I must tell they have changed the bed.
We are happy that he's completely recovered from the operation and he's on his way back home. We wish him well. He will be under our follow-up. We will be seeing him again in about 6 to 8 months' time for repeat blood tests and CT scans, and we will keep him under our follow-up for the next 5 years.
And also, I give special thanks to the international desk of Apollo Hospital. Josh Jacob also, he has almost every day, he kept communication with me or with my attendant so that and inquire about my health condition. So pray for me. I am also pray for you. Thank you very much.